HIE Awareness Month, everyone. I'm Betsy Pilon, Executive Director of Hope for HIE, HIE Parents, and I'm thrilled to welcome back Dr. Monica Arroyo. Monica is a pediatric neurologist at Joe DiMaggio Children's Hospital. She's going to give a deeper intro about herself, but I'm so thrilled to have you back here today, and we're kicking off our HIE 101 series for Awareness Month this month. And we're starting with what causes HIE, which is something we could talk about for days, weeks. It's not a easy black and white one to talk about. So we're going to dig deep in the time we have today. So Monica, welcome back to our Q&A series. And can you just give us a little bit of overview of who you are and the work you do and, where you practice and kind of the dynamics, that come with that?
Betsy, first of all, thank you so much for inviting me. So happy to be back and engage in these platforms and raise awareness for HIE. So I am a pediatric neurologist. My role is really mostly clinical. So I am kind of boots on the ground taking care of babies. And we are at a very busy NICU in South Florida, 90-ish beds, and we're a referral center for cooling babies. So in a slow month, we'll have one baby a month. Sometimes we have 3, sometimes we have 4. So we have a lot of babies coming in and out. And like you very well alluded to, the causes of HIE are very mysterious and sometimes keeps us up at night, trying to take care of babies and try to take care of parents in this like traumatic situation. And sometimes finding an answer or a reason is so helpful in this kind of complex grief process. But like you alluded to, it's really, really complicated to find out sometimes.
We are going to start in the beginning of when HIE could happen, which would be the first cohort of people would be in utero, right? What can happen to cause HIE? Either a sentinel, which would be an event, or kind of a chronic or over time. What are some things that can happen during gestation that could lead to HIE?
Yeah, so I think, pregnancy is such a delicate time. And one organ that's a little bit maybe understudied and we're learning more about is the placenta. So when a baby is growing in the uterus, the placenta is really kind of its life source. There's blood coming in. And the placenta can be affected by many things. And it can be a genetic issue. So the information to form the placenta is different. There could be an infection that happens and it affects how the placenta can work. And maternal stress or even illnesses like high blood pressure, diabetes can affect how the placenta grows. And the interesting thing about the placenta, well, many interesting things, is that a lot of the times when women are pregnant, they're getting all their checkups. We can't really tell the placenta is not working perfectly, right? So it's one of those like surprise situations that can happen after an HIE presentation where we look at the placenta under the microscope. And that's really the only time that we can tell that organ just wasn't working well. And another thing that can happen in the womb, which is really in no one's control, just like the placenta development is really in no one's control. Biology is very complicated. The umbilical cord is also very important, is really also an extension of that lifeline. And the cord can get entangled. It can get compressed if some women's uterus have a different shape and the baby can be kind of bad luck, how positioned, right? And it can cause the cord to actually not work very well. It can be compressed, and that compression can be intermittent. So it's a little bit compressed, then the baby moves and the cord's okay. So a lot of the times that intermittent compression is not long enough to cause a symptom like, hey, the baby's not moving. So these are also things that because we hear a lot in HIE, everything's perfect until it's not, right? So some of these pregnancy factors, based on the technology we have Now we can't really determine, which is very frustrating, and I wish we could. But that's sort of what can happen in utero in a nutshell.
Yeah, and we see obviously with having such a large community, over 10,000 families, just so many different stories and so many origin stories of what can cause HIE. And so, we've had families who are cooking along with their pregnancy. They might have a spontaneous placental abruption. Those, like when we get into the sentinel events that can happen during in utero, and a lot of times people talk about these sentinel events happening just around birth, but yet there are definitely a cohort of families that had these things happen that led to them going to labor and delivery for an emergency C-section and things like that. Can you talk a little bit about those?
Yeah. So even, a uterine rupture even can happen spontaneously, like even before the delivery, or, the cord issue can happen like more abruptly, even before the delivery. So even the sentinel events, like how we like to think about it is, it's a clear before and after. Like there's a clinical picture right before and there's a clinical picture right after. And in general, and probably will stress this a lot because we stress this a lot with families, that there's a lot of the times that there's like nothing really that can be done to prevent these type of situations. It's not mom's fault or dad's fault or the medical team's fault. It's just these situations are extremely complicated, and there's all of these really like finite biological processes that are happening at the same time, and sometimes it's just really bad luck.
Yeah, it's so complex and difficult, and again, the stories of so many of these causes, obviously it's heartbreaking in so many levels. And so as we work through gestation and going to, and I know I want to say too, we've covered before, and there's another Q&A that I want to reference. We had an MFM on a couple of months ago, Dr. Christian Parabak, who is doing some work. He's doing like preclinical work, so in a lab with animals, not humans yet. And then he's also looking at case studies and case reviews of a hypothesis that, as you talked about genetics, a lot of people think of genetics as like a genetic syndrome, right? Because that's really, people hear about that much more now than ever before. But there's genetic expression and there's genetic changes that aren't necessarily like you have bad genetics or you have a genetic condition, but how your genes go, and yours and the babies and all these things together. His hypothesis is looking at, are there some babies that can't tolerate labor that we can identify in prenatal testing that would decrease the incidence of HIE, because we know that they're more predisposed to that. And we're not there yet, obviously, early stages, and he shared his early stage work. But I'm really thrilled to hear that there are some researchers really looking at that. And I know that there's been research at the NIH, the Human Placenta Project, looking at how we can do a better job of developing the tools to have better prenatal testing that could identify, and then some women might then track to be a high risk if there's some markers that they find with the placenta. They will do basic blood flow and things like that at those early checkups of the umbilical cord, but sometimes that just doesn't catch everything. So there's a lot that's accelerating in that. I know we've had families. There's a parent I can think of that's enrolled in a clinical trial with the Human Placenta Project, doing an MRI with a subsequent pregnancy during pregnancy to learn more. So there's a lot of those things going on. So I think we always want to balance like talking about the hard stuff with the hope of the future, of what we hopefully in 10 years from now can talk about have decreased and the incidence or the impact of HIE. So as we move forward, let's talk about like kind of what can go wrong during childbirth. All the things that can go wrong. Here we go.
I mean, there's a lot of things that can go wrong. And as a neurologist, I'm not an OBGYN doctor, and we get thrown into these positions a lot, like, this is happening, what do you think? Like, what would you have done? I'm like, well, we don't really know, that's why we're a team, right? But I can tell you that sometimes things go wrong with mom. And, we've had moms go into cardiac arrest. Moms have, a medical situation that affects their breathing, like a severe allergic reaction. During the pandemic, we saw moms with mild COVID or severe COVID having some issues with breathing. And sometimes just the bleeding from the delivery can cause a severe issue with that blood flow going to the placenta. So that is something that can happen in the delivery in mom's side. Okay. When it comes to the baby, we talked a little bit about the cord prolapse. There's a, uterine rupture that can happen with the contractions. And then the baby can get stuck coming out. That's what we refer to as shoulder dystocia, where the shoulder just gets stuck and there's a problem delivering the baby. And, there's all of these other things after the baby comes out, like as the baby's coming out. Meconium aspiration is really, really commonly seen as a cause of affecting breathing right at birth. And then other things that moms can get that are very unfortunate, like the preeclampsia that's very severe and causes seizures, diabetes that's very out of control that can affect how the delivery goes, babies that are very, very big and maybe unexpectedly very big. And there's other more esoteric things like autoimmune problems that affect the red blood cells, where you're born and your blood is not able to take oxygen to your brain.
Yeah, so many causes. I know, like you mentioned COVID, and we've shared some of the latest research where, before 2020, COVID obviously was not a cause of HIE. And they found that, because it makes sense, like COVID can affect oxygenation, that, when it affects the mother and especially severely, it can affect the baby as well. We know that preterm birth increased from COVID cases, but also adverse outcomes like HIE can as well. So that's definitely something that got added to the mix over the past couple of years as a new cause. And then when we talk about, during childbirth, obviously like things like prolonged labor and things that can go wrong that might be, I know, some things can be prevented, some things can't be prevented. And so, it's mostly during HIE during childbirth that can come into play a little bit. Can you talk a little bit about that?
Yeah, so the duration of labor is also a little bit tricky for neurologists because we're maybe not as attuned with that. But we hear a lot of stories, lots of stories. So, I was pushing for this long. My baby was in distress for X number of hours. And it's really challenging sometimes being a referral center. You get a patient from maybe another institution and you don't have all the nitty gritty things available to you. But I think that this presents itself over and over as an opportunity to continue to collaborate with our OB colleagues who are really experts in labor duration and what to best do. But we hear a lot of those stories that a lot of the times when labor is really prolonged and there's that normal tracing and in the heat of the moment that, the heartbeat can drop and was that preventable or not? We don't know, right? But it can really happen in an instant, even when things are going okay. Like I heard a quote from a parent the other day. The mood was really cheerful in the delivery room until the baby came out, right? So that's how quickly things can change. Like we made it, we're at the finish line, and then the baby came out and the baby's not breathing. Can happen.
Well, and I've heard about, we did a causation one on a little bit different with Mark last year, and he talked about a little about fetal reserves. And I thought that was an interesting concept that I don't think gets talked about a lot. And he talked about how birthing itself is a hypoxic process. So like, what's the difference between, right, where it's part of normal physiological birth, and then it crosses over to be HIE? Like, what,
Yeah. Biology is complicated. Being born is complicated. Being born is stressful. And I think, maybe we haven't talked about it yet today, but a lot of the times there's a combination of things, right? Like, it's like we're trying to untangle the mystery of what happened. And it's not one single thing. It's a combination of things. And some babies, for some reason, say the placenta wasn't perfect and maybe if the delivery was smooth, there wouldn't have been an issue. But then you have a placenta that's already compromised a little bit, and then you have a labor that's more prolonged, or shoulder dystocia, or meconium aspiration. It's sort of like stacking the odds against this little baby. And that's kind of where we use the term reserves, right? Like maybe the low reserves are the placenta wasn't perfect, or alternatively, this baby is more resilient because the placenta hadn't been perfect. So I think there's still a lot of things that we don't understand about the process, and it's very exciting to think that there is research coming down the pipeline that will help us pinpoint the cause, because it's just so important for families and even for us taking care of babies. We don't want to miss something, right? And if we had better idea of how to prevent it, or worst case scenario if it happened, to be able to have a better timeline or causation, it would be great.
Yeah,
really great.
For sure. And, I know, I think when we prep this, we're going to talk about first neonatal encephalopathy.
Yeah. Oh, yeah.
So
we just went right to HIE.
We just went right into it. But, there's lots of terms that are used. And HIE, hypoxic ischemic encephalopathy, is used under the umbrella of neonatal encephalopathy. And what does that mean? And what are the other buckets under that umbrella?
Yeah. Well, we can even take it a step back, because I think most people don't know what encephalopathy means, right? I mean, it's such a fancy, beautiful word, but nobody has heard it before, right? Unless you're in the medical field. It's a very unfamiliar word. So for us in neurology, the easiest way to describe it is someone that's not acting normal, right? So if I had an encephalopathy, I'm an adult. Sometimes I'm sleep deprived, but I'm an adult. So if I was encephalopathic, I'd be confused. I'd be slurring my speech. I wouldn't know how to use my body. Maybe I couldn't walk, or maybe my level of alertness wouldn't be normal. And you would say, oh, that patient has an encephalopathy. They're not acting well, right? So when you think about a baby, like, how can you even describe that, right? So an encephalopathy in a baby is a patient that is not acting, a baby that's not acting as expected, right? Term baby, not doing certain things, makes us think the baby has an encephalopathy. So the term neonatal encephalopathy, it's an encephalopathy that presents in the neonate, right? In the newborn baby. And that's, like you said, an umbrella term. The majority of the times it is hypoxic ischemic encephalopathy, but sometimes it is not. And sometimes we don't know what it is, right? So I think it's appropriate to tell parents, the baby has an encephalopathy, we're going to work it out. And depending on your clinical acumen and information you have, you can use the term HIE right away if you have the data for it, right? If there's a sentinel event, if your blood gas, which is when they check the blood and you can tell the components of the blood, how acidic it is, or how compromised the blood flow was, right? Because ischemia, just to define more terms, lack of blood flow, right? But there's other things. There's some genetic syndromes that can present with an encephalopathy. Like, genetics can affect how we act, how we move, right? So it could be a genetic syndrome that affects your movement. It can be a genetic syndrome that affects your alertness. A genetic syndrome that just has seizures, and seizures can affect your alertness. So it can be a patient that just has, nothing. There was no HIE type situation. It was more like just their genetics. Patients with a severe infection, whether it was mom that had the infection and then they acquired it in the womb, can look very encephalopathic. They're not acting well. They're not moving. They're even acidotic sometimes, right? And then there's other things in the brain, like their brain wasn't formed correctly, and they have a severe brain malformation that affects how their brain works. A stroke, which is lack of blood flow from one artery, either from a clot or from the placenta, or from another abnormality of blood flow to the brain that's more specific to one part. And basically other things. Well, these are like the bigger categories. And Betsy, correct me if I'm missing any, but HIE is just the most common one. But when we don't have a story for HIE, we're in the neonatal encephalopathy hunt, and making sure that we don't miss a diagnosis that might have a different treatment, or also be realistic with families up front that maybe the cooling or therapeutic hypothermia might not help their child as much as a patient with HIE. Sometimes we try it anyway because we don't want to miss an opportunity, but also saying, we think this is an infection. We're going to do everything, but, we're going to do the antibiotics, we're going to do the cooling, we're going to do this, but this might not be an HIE case.
Yeah. And it's really, I've heard it described as, kind of going on a hunt of, a mystery that you're solving. And I've asked questions, of many people of when is the time, because a lot of families obviously are like, why didn't we hear it? Yeah, a lot of them now, like you said, if it's something that feels very clearly, we know the cause, they might get it right away. Some people, I'm always blown away when people are like, oh yeah, my OB told me that's HIE, like in the delivery room. I'm like, what? Like, that's crazy. It's great. Like that they feel confident to make a diagnosis early on. But for those that don't, and I've asked many, ask the audience of neurologists, neonatologists, when do you feel confident, like saying something is HIE? And there's so many different, there's a wide spectrum too. There's mild, moderate, severe, and all of those look very different. And it seems like, day 5 seems to be kind of a 5 to 7 or the days that, which seems like a long time for families to wait for that confirmation. And I know the MRI, we're going to do another one about, how HIE presents and all the things, with Dr. Liz Sewell in a couple of weeks. But certainly, those are other pieces to the puzzle that you're collecting along the way for more information as rule outs. So when we talk about, and we talked, in our prep for this about that genetic testing is now becoming more standard as a rule out, right? Because you don't want to miss, like for a lot of the genetic conditions, if it's something that does present at or, around birth, and it might have a therapy for that, that's specific. So can you talk a little bit more about how that's being used now?
Yes, absolutely. I mean, I think genetics is like the next frontier in medicine, right? So whatever we don't understand or whatever we think could have an impact, we think about genetics. I think, among colleagues, I feel like depending on resources is like maybe how often things are activated. I think as a community, if there's no clear sentinel event and we're not sure what's going on, most centers are getting genetics because that's like, well, let's try to get answers. And sometimes even if the sentinel event is there, but maybe the presentation just seems like exaggerated for maybe imaging or clinical course, I think that's also a time where limited resource centers are using it clinically. And there's other places that are pretty routinely HIE patients getting genetic testing. I don't know what feedback you've gotten from the community about that.
Yeah. And I know that, we're a part of the Neonatal Seizure Registry, and there's NSR gene, which is looking at genetics of neonatal seizures. HIE is the top cause of neonatal seizures. So I think we're seeing some families definitely that enrolled in that. And then there's other centers that are looking at doing, like with clinical trials, let's do genetics on every baby that we can consent in and see what we get. And I know that, some genetic testing has been done. It was done on the HEAL study.
Yeah.
They found 5%, was an overlap. And then Dr. Christian Parabak, who I mentioned earlier, the MFM, he did a smaller cohort, but it was like upwards of 20%. So, of suspected HIE. So it's very interesting. And we, and again, you could analyze 50 cohorts of 50 different babies with HIE, and you're going to get maybe 50 different answers. Because it is so individual.
And I think every year it's changing. So we have patients that we see in the practice, maybe that, are 7, 8, 9 years old. And you kind of wonder like, should we get genetics now? Because it kind of never really fit, or, it wouldn't be nice to know, right? So I think that families that like enter this like Hope for HIE support space might be coming from like, older children. I know that for transition for adult neurology, there's a lot of push about when you transition a patient to adult neurology, you have to try your best to have a very clear understanding on the pathology, right? Like this is a patient that has cerebral palsy because, and then if you can't answer that question confidently, you should probably try to before you send them, right? Because our adult colleagues maybe are not as well versed in these things as we are, or out of a kindness, like, hey, this is a transition patient. transition is such a hot topic in neurology, and your parents are worried and nervous. And I think that this is like the kind of things that we can do before we transition. Like, hey, this is a patient, and this is what we found. And even genetics, sometimes they don't find anything, or these variants that we don't know what they are. Then we get an email 1 year later, 2 years later that, the variant, hey, that variant is now important, or that variant is now not important. So, genetics is also an evolving field. And just because you send genetic testing today and you don't find anything, that doesn't mean that you won't find anything next year. So I think it's really always in our mind whether there's a genetic process going on.
Right. And interesting that some of these things can co-occur. So HIE can co-occur with stroke or with genetics or with infection, and that, again, it's we all, I think, want this like A plus B equals C. And sometimes it's just not that tidy. It's really murky. So let's move forward and talk about this happens in about 5% of neonatal HIE, which is SUPC, a sudden unexpected postnatal collapse cohort. And we do have families in our community that have talked about this. And these are the kids that come out pretty well, good APGARs, decent blood gas, and then, kind of have a lot of them will develop neonatal seizures 12 to 24 hours later. Can you talk a little bit about that?
So these cases are very scary. Scary for us too, because we always wonder, like, did we miss something? Did something happen that we just didn't notice? Because by the time that they present with seizures, they can't really benefit from hypothermia, and we always feel like, hey, we missed an opportunity. But these patients are well appearing. Sometimes they're in the newborn nursery, or maybe they're in the NICU for some other maybe unrelated reason, and this happens. I feel like when I've encountered a patient like this, I've definitely delved into genetics. And I think that, if there are families that have gone through this situation, I would advocate for them to get genetics if they haven't, right? Because these are the ones that you want to just make sure that we have all the information. And heartbreakingly, sometimes the placenta is not available. Sometimes when babies don't go to the NICU, the placentas get discarded right now, right? Maybe in the future when we feel like we know a lot more, then maybe we'll keep them for everybody. So you're kind of a little bit stuck. Like, okay, how do I help this family figure out, is there anything that happened to this baby? So you kind of go through your head to toe, like $1 million workup, how we call it, right? Investigate everything. Locally, it's a very small percentage, but it can happen, and it's really frightening. And I, as a clinician, I'm hoping that we get more answers or research in this space, because these are the patients that you feel like maybe, oh my God, what happened? And I'm sure for families it's very distressful because the patient was doing well. And sometimes we don't know it. We're not really confident it's HIE until like after an MRI later, because you see a lot of inflammation in the MRI. Not to talk about too much about MRI today, but sometimes with the seizures, you can't really tell, is this from seizure or is this like true ischemia? And when you don't have this story, it's hard to put it all together. But then when you do an MRI later, then you might see that those changes were from ischemia because those cells really didn't grow, right? So sometimes it might take months to get answers. Parents were like, okay, what, did we position them wrong? But, they didn't turn blue. Like, we go through all of the things, like, where was the baby sleeping? If they were in the nursery, what happened? And that investigation can feel like accusatory, but it's really not. It's just more like it is distressing for us when it happens, right? And we want to make sure we don't leave any stone unturned.
Yeah, and I think what's interesting with research is we have the Cool Prime trial going on for mild HIE, looking at cooling and the comparative effectiveness of that. And what I am really looking forward to seeing the data come out, because, I get to be on these calls and some of our other family members are, on status updates about the trial. And part of the protocol is babies that are appearing mild will get EEG, and how many aren't actually mild because they're having subclinical seizures, and thinking, how many are we missing potentially that are actually not mild babies and are moderate, or, look decent, and there's some really good research and good tools that they're developing. There's a company called Surgenix that's developing a screener that's a non-invasive, they have a couple of different positional electrodes, and that's going to be really, I think, really key to see, a screening for everyone. They say, when babies are screened when they're born, you look at all the systems, but you don't look at the brain, right? You're listening to the heart and the lungs, and what do we have to screen the brain? So I think that'll be really interesting as we move forward to see if potentially, hopefully, and hopefully it's not totally resource dependent, our screening practices will change, and catch more babies that could be cooled.
Yeah, I think a lot of centers are doing like maybe baby trials where they have these babies that like they're looking at closer for cooling because they have a mild encephalopathy, or, some centers are doing ED. Again, it's resource dependent. And I do feel like on the flip side, in the neurology space, we see patients that come to us later in life for a learning issue, attention issue, behavior issue, developmental issue. And you always ask about the pregnancy and delivery because that's part of our history. And the parents will mention things like, now that I think about it, the cord was wrapped around the neck. And you're like, is it related? Is it not? I mean, the technology is hard for us to kind of put it all together, but it is interesting because you hear things like this pretty often. So we'll see. We'll see.
All right. So moving on to the next type, and this is the pediatric-acquired. I know this is near and dear to your heart because unfortunately, living in Florida, I know you see a lot of near-fatal drownings and other causes. So can we talk about what might cause a pediatric-acquired HIE?
Yeah, so this is very, it's different kind of beast because these are patients that were healthy until they were not. And, in pediatrics, cardiac arrest or respiratory arrest leading to cardiac arrest can happen in patients that have, severe respiratory illness, like asthma exacerbation. There's a population of babies that their heart is different, like all of these congenital heart disease patients. And they're at risk for having some kind of compromise because their heart's different. And sometimes the arrest can happen in the hospital, which is really hard, right? You come from the cath lab or something happens in the hospital. You're very, very sick with a pneumonia and it evolves into a cardiac arrest situation. Or you can have a cardiac arrest at home, choking, near choking, and then the near drowning. So near drowning essentially means a patient that is underwater and could have drowned, meaning could have passed away if after a certain period of time they didn't recover their breathing and their circulation. And here in Florida, unfortunately, it's pretty prevalent, more than we would like to admit, because we have pools and we have lakes all around us. And these are very difficult patients to take care of because the families are grieving. There's a lot of guilt involved, which there shouldn't be, right? All parents take care of their children, but it's just accidents happen, right? But an area of advocacy for parents of any children, even parents maybe had HIE and for part of their safety or seizures, that's also a very vulnerable population, right? The water is pretty and the water is fun, but the water is also very dangerous. So we have to, always watch our children out, when they're in the water, and patients with epilepsy or any developmental delays are really, really fragile because they don't understand. And if they have a seizure in the water or something like that, you really should be at arm's length of the patient. And here in Florida, there's a lot of advocacy about early swimming lessons and pool fences, pool alarms, and things like that. And we've had some issues because we have a lot of vacation homes, like Airbnbs, and the population that stays in these Airbnbs are often families or visitors. They might come from other states and where, there's not as much pools or beaches. And sometimes kids are very excited to be in a house with a pool, but a lot of the times the houses are not well equipped with safety measures just because the population they're catering to is more like adults. So I think that's also an area of advocacy, that if you are traveling with your children and there is a pool where you're going, please take extra precaution because kids are excited.
Yeah. And one of the things I want to mention here as well is there is a research work group that's starting that reached out to us, and we've been in touch with our pediatric-acquired community. And it's the Pediatric Neurocritical Care Work Group that has people from different children's hospitals and things like that. And they're wanting to come together to set a research agenda. We know that research in particular for this population, the focus has so heavily been on neonatal HIE. And this population kind of, has not had that focus and that energy behind it. So if you are a part of that population, you're interested in getting involved, please reach out to us. There's a call to action in the acquired group that we have. And we want to really help move forward things for that population and serve them well. Because it's different. It's heartbreaking. I know when families come in with an acquired event, you're relearning who you had your kid, and it could look very, very different after what has happened, and how you move forward in life, and looking at what research can be done. I'm really thrilled to be connected to these researchers and see that this is happening. The focus on this population, it's long overdue. So, and I'm really thankful for you to share the advocacy points for all of us, regardless of our kids and things like that, of being more mindful about safety. Swim lessons. There's swim lessons for adapted swim lessons as well. Like it's, my son Max, who's now almost 13, he started being able to safely go swimming he has epilepsy as well, so we're always within close proximity, but being able to swim independently, just about a year and a half ago. So this is, it's terrifying as a parent. You want them to enjoy, you want them to to really be able to have good skills, but sometimes it's really tricky depending on their differences and disabilities too.
Yeah, and I think the water has a lot of therapeutic benefits for our patients, particularly the cerebral palsy population. So I think, people shouldn't be afraid of the water. We should embrace it, but keeping in mind that, the safety measures have to be in place. And we've met people that have had 2 events, like genetic problem at birth and seizures, and then had an event later in life in the water, in the bathtub. That's another place we didn't mention. So I think it's important to talk to our families, not just assume a child, this patient probably can't learn how to swim because they have physical limitations, but they can be in the bathtub. And I think that all parents should have the opportunity to discuss water safety, and also whether their children could go in the water and have a good time. Not assume that people just can't do X, Y, and Z.
Right. But we can do it in a safe way.
Yeah,
for sure.
Yeah.
Well, gosh, we've covered a lot of ground today.
I think that, in conclusion.
Yeah, right. In conclusion.
There is a large percentage of time that, based on the technology and the information we have, we can't have a clear explanation for a patient's HIE. And we know it's really difficult to accept or to acknowledge. And I think that when we counsel families, there's a lot of different things that we say, okay, let's check this, let's check that. I think the placental pathology, when available, is becoming like one of our number one things to counsel about. Let's wait for it to come out. Let's sit down with the right people to talk about it. And I don't know, Betsy, like you're so involved with everybody's stories. Like, I'm sure you hear people get really frustrated when they just don't know why, right?
I think everyone, we're human, right? We want to know, we want a definite cause for something bad to happen that we can paint it back and try to move forward. And I think for a lot of us too, it affects family planning, depending on the cause, you could, be high risk in another pregnancy, or it's not advisable to be pregnant again. It just depends on the mother's physiology, genetics, causation, location, all sorts of things that can get wrapped up. And so, when we talk about pregnancy after HIE, and we do have a, specific support for that as well, we talk about MFMs quite a bit, and really recommending, if you have access to an MFM, you don't have to see them when you're pregnant. You can see them on a consult basis. And I shared a little bit of our story yesterday in a video of talking about the MFM that we were referred to at my postpartum appointment, because for my story, Max stopped moving when I was 37 weeks pregnant, had no really indications that anything was going to be wrong. Had good prenatal care, first pregnancy, no risk factors that I knew of or that they flagged me for. And so, my postpartum appointment was like, what happened? Can this happen again? And, can I have more kids? Like, what are the risks, And the OB who, was not the one that delivered me. I was in a group practice, so he saw me a couple times, but he was like, he was not one that handled adverse things well. And it was very uncomfortable for him and for me. And, he like fumbled around to find the card for the MFM. I met with her. She was brilliant. Went through my placental pathology, went through my prenatal records, my birth records, all the things, and was able to say, this is what I think happened. I don't really know. We don't see these very often at all, but this is what my plan would be for you moving forward. And when you're ready to plan for another baby, let's talk. And we'll get you, started on a good plan to meet your individual physiological needs. And she walked me through my second pregnancy. I know other people that have gone through with MFMs, and it's just a higher level of looking at that whole interplay of what information is available. So, families deserve to have answers as much as answers are available. And so, I know you feel strongly about that as well. And we all try to do our best as we come together.
We try our best. I think that we, neonatologists are also very detail oriented. Neurologists are very detail oriented. We work with the OB team to try to find answers. Sometimes it's just not possible with the technology we have now. But there's always we're hopeful that the future will look different. And I think a preconception counseling appointment with MFM is so valuable. I think also to have a team if you're going to get pregnant again, or even if you're not sure, because they go through everything, like you said. I mean, sometimes they find clues that we didn't see. It's sort of like solving a mystery. And I've seen many families go on to have healthy pregnancies a second time around with maybe no change to the plan or a minimal change to the plan. Because like we talked about, stress can affect a lot of stuff, and pregnancy after HIE, I'm sure, is very stressful. So having a team, a supportive team, makes sense for a lot of reasons.
Yeah, for sure. Well, as we wrap up, we always ask, what are your resources that you want to share with families?
Yes. So Hope for HIE.
Oh.
Hope for HIE is a very, very good resource. CP Alliance is another resource that we talk about. And I feel like a lot of parent support groups that are specific for genetic syndromes, if we do make a diagnosis, I'm a big advocate for it. I know that sometimes people are not ready for that when you first get a diagnosis, but we learn so much. I mean, so much from all of these parent support groups, or either through social media or parent foundations, that people just connect with each other. And sometimes the medical literature is not as up to date as what you parents all talk about. And those are my biggest things that I always advocate for. Let's find your people. Mm-hmm. I'm part of your people, but I don't understand everything you're going through. Let's find your people, right? And share with me what you find from your people, and we will take that information, and if it's within the scope of things that we can do, we will do it.
Excellent. Thank you so much. What a robust conversation. I can't believe we kept it under an hour.
Yeah, lots to talk about. So I hope that it's helpful to go over these things. Some of these medical terms are a little overwhelming. So hopefully we were able to explore some themes a little bit more in this conversation.
For sure. And thank you so much for Monica is on our medical advisory board and has been for several years. She is also passionate about making sure that the Spanish speaking population has resources. That I know that home for you has been Puerto Rico, and you have family there, and there's other amazing physicians that are looking at building more within Puerto Rico. So if there's families that want to get more involved in those efforts as well, please reach out. So you are just such a champion for the families that you work with, for HIE, and we're so grateful for everything that you do for the foundation and the care that you provide for families. We're just so lucky to have you, and families are so lucky to have you who are under your care. Thank you. So much.
It's really a journey. It's we celebrate all the wins together. They're worth it.
Absolutely. All right. Well, and thank you everyone who's been tuning in today. I know people have been shouting out, Maria, who says hello to Dr. Arroyo, who knows you well.
Yeah.
And then others in our community have been sharing where they're tuning in from. So if you're catching this on the replay, you're welcome to continue the conversation in the comments or reach out to us at outreach@hopeforhie.org. And we'll continue moving forward. Our next HIE 101 session, we have a couple others throughout HIE Awareness Month. We're going to do all about MRI. We're going to do HIE diagnosis, like what comes after, birth. We covered like everything that can lead to HIE and where HIE enters the world. And then we're going to talk about what comes next as well. So please join us for those. You can stay up to date on our website and on hopeforhie.org/events for all of our events, support events. We have our newly diagnosed support group tonight with our social worker, Jen Schaefer, and a couple of our peer support mentors. There's always something going on. So let us know what you need always. And again, thank you everyone for tuning in, and we will see you soon. Thanks.